Hello and welcome to this month's virtual presentation. My name is Rachel Cocar and I'm a licensed social worker here at KSB Hospital. September 8th through 14th is National Suicide Prevention Week. In this presentation we will talk about suicide, but even more importantly about suicide prevention. Much of the material I am sharing today comes from the Suicide is Preventable website. We cannot always prevent or remove suffering and pain, but we can cultivate hope and support resiliency by learning more about suicide and how to help those we care about to find their reasons for living. We will learn about clues and behaviors known as warning signs that might indicate someone is thinking about suicide, what you can do if you are concerned about someone, such as how to start an open and direct conversation with them about suicide prevention, and what you can do if you are concerned about someone. We will get to know the resources that are available where you can learn more about suicide prevention and to get help for yourself or someone else. Historically, and even today, suicide carries a lot of stigma, prejudice, and fear. People who are thinking about suicide may be hesitant or afraid to tell someone about their thoughts or reach out for help for fear of what others will think, worry about how it will affect their family and relationships, or even their employment. Some people may doubt that anything can be done to help them, so why bother? Sometimes people thinking about suicide already feel like a burden to their loved ones and don't speak up out of worry of becoming even more of a burden. It can help to understand that people who are having thoughts of suicide are experiencing intense emotional pain. Most of the time, they don't want to die, but they cannot see a way out of the pain or are able to continue to live with the pain. Not wanting to live is actually different than wanting to die. We can reduce the stigma, fear, and prejudice around suicide, increasing our knowledge and educating others, trying to understand and respect the pain that someone who is having thoughts of suicide is experiencing, and feeling more confident to talk directly about suicide with someone we are concerned about. Knowing the warning signs of suicide is one of the most important first steps in prevention. It's also important to know the difference between warning signs and risk factors. Warning signs. A suicide warning sign is the earliest detectable sign that indicates a person is at heightened risk for suicide in the near term. For example, within minutes, hours, or days. These are observable clues and behaviors. Warning signs relate to an individual's immediate state. Similar to the warning signs of a heart attack, such as chest discomfort or shortness of breath, the warning signs of suicide signal the potential for immediate or short-term crisis. Also, similarly, it is a cluster of these signs that most strongly signal risk, rather than only one or two warning signs. Risk factors. Suicidal behavior is complex and is not caused by a single risk factor or life event. Risk factors tend to be longer term than warning signs and are not in and of themselves an indication of immediate suicide risk. Whereas warning signs always refer to an individual's current state, risk factors are often based on population level data. To continue the analogy, risk factors of a heart attack might include older age, family history of heart disease, and lifestyle factors. Keep in mind that every individual and situation is different. What impacts one person profoundly might not have the same effect in another due to a wide variety of factors. Because someone has risk factors does not mean that they are or will become suicidal. Although much of the attention in suicide prevention is paid to warning signs and risk factors for suicide, it is equally or even more important to consider the strength of protective factors against suicide. Protective factors are personal or environmental characteristics that help protect people from suicide. In theory, a person with strong protective factors would have greater coping skills to deal with higher levels of stressors than someone without supports, therefore reducing suicide risk. Even someone with very strong protective factors can become overwhelmed and potentially suicidal. But protective factors can create greater resiliency during tough times. On the slide, you see a few examples of protective factors, including access to effective behavioral health care, connectedness to individuals, family, community, and social institutions, life skills, including problem-solving skills and coping skills, ability to adapt to change, self-esteem and a sense of purpose or meaning in life, cultural, religious, or personal beliefs that discourage suicide. Pain isn't always obvious, but most people who attempt suicide give some indication of their thoughts and feelings prior to taking action. These warning signs may be behaviors, words, social media posts, or attitude changes. Learning to recognize these signs and how to respond appropriately are actions that you can take that may help save a life. The critical warning signs of suicide are cause for concern and should be taken seriously. These include threatening to hurt or kill oneself, or talking of wanting to hurt or kill oneself, looking for ways to kill oneself, such as purchasing a gun, stockpiling pills, or researching suicide methods online. Talking or writing about death, dying, or suicide when these actions are out of the ordinary for that person. Warning signs of suicide are especially concerning when the behavior is new, has increased, or seems related to a painful event, loss, or change. Examples might include the loss of a job, a spouse, or a loved one. These additional warning signs may not indicate an immediate crisis, but are also cause for concern, especially when the behavior is new, has increased, or seems related to a painful event, loss, or change. Feeling hopeless and or worthless, fear of becoming a burden, a preoccupation with death, or a lack of concern about personal safety or recklessness, feeling trapped, a sense of a downward spiral and no way out, increasing use of substances, especially alcohol, anger, irritability, resentment, seeking revenge. Often we think of someone who is having thoughts of suicide as always being sad or depressed. However, anger and aggression is how some people express their pain. Changes in sleep, withdrawal or isolation, sudden uplift in mood without a reason could signal they have created a plan, which often includes a sense of relief or improved mood for the individual. This warning sign should be taken very seriously, as it might demonstrate the individual is at an increased risk of suicide. The most important thing is to trust your instincts. You know your friends and loved ones best. If you feel like something is off or notice some of these changes, then you need to have a conversation with them and ask directly about suicide. The Suicide is Preventable website has a section devoted to recognizing the signs of suicidal behavior that could be helpful. When you click on the Know the Signs portion of the website, you can find warning signs for the general public, teens, and older adults. When you click on a sign, more information will pop up, as seen in the slide included here. If you sense something is wrong, don't delay in getting help. The first step is to find the words to have a conversation with someone you are concerned about. During the conversation, express your concern and mention specific things you have noticed that have caused your concern. Ask them directly if they are thinking about suicide. Starting the conversation may seem intimidating, but it's important to remember that usually when someone is having thoughts of suicide, they are looking for an opportunity to talk about it. Remember, you aren't expected to have all of the answers. You're simply trying to create the space to have an open conversation about suicide. Start by expressing your concern and mention specific things that you've noticed. Let them know you care about them and you want to help. The next step is to ask them directly if they're thinking about suicide. It can be difficult to do this because we might be afraid of putting the idea into the person's head, or that bringing suicide up will cause it to happen. In fact, the opposite is true. Talking openly and directly about suicide is the first step in preventing it. Often people who are having thoughts of suicide isolate and don't share their thoughts for a variety of reasons. They may feel like they would be burdening their friends and loved ones, or may not believe anyone wants to help. Asking directly about suicide invites the person to talk openly about their thoughts, lets them know you are there to support them, and conveys that you aren't scared to talk about suicide. These conversations often release a pressure valve that begins the process for reducing risk by making suicide an issue that we are going to address together. When you ask the person if they're thinking about suicide, they may say no. Here are some tips for what to say and do if that happens. Continue to encourage them to talk about how they're feeling. Support their coping and resiliency. Ask them what helps them feel better. Encourage them to reach out to resources such as the Suicide Prevention Lifeline or other resources that can offer tools for coping and support. Remind them that you are there for them. Listen without lecturing or judgment, and be vigilant about the behaviors you are noticing and continue to check in with them on a regular basis. If they say yes, take it seriously, but remain calm. Remember that just being present with them is helping to reduce their risk and keeping them safe. Thank them for their honesty and openness. Encourage them to talk about the reasons they feel this way and listen. Truly listening is the most important action you can take. Explore and see if you can help them identify some reasons for living. And encourage them to reach out for help. Let them know you'll support them and offer to make the call with them. The next step is to plan for safety. Ask them if they have access to weapons or medications and work with them to safely store these items. Help them identify signs of crisis and things they can do to help take their mind off their problems. Make a list of who they can call when they are in crisis. This can include trusted individuals, mental health professionals, or crisis lines. Having a list of resources available before you have the conversation is helpful, not only to share with the person you are concerned about, but to support your confidence that you are not alone. The resource on the slide is available 24/7 to support people who are in crisis and are available for you to contact for advice and discuss your concerns about someone else. When you call 988, you'll be answered by trained call takers with advanced training in de-escalation and clinical suicide prevention. 988 is a direct connection to compassionate care and support for anyone experiencing mental health related distress, whether that is thoughts of suicide, mental health or substance use crisis, or any other kind of emotional distress. People can also call or text 988 if they are worried about a loved one or someone who may need crisis support. Using this service is free, confidential, and available 24 hours a day, 7 days a week, 365 days a year. On the Suicide is Preventable website, you can find a section called Find the Words. On the Find the Words portion of the website, visitors can find a step-by-step approach to have this difficult conversation with someone they are concerned about, including tips on what to say, what not to say, and creating a safety plan. There are local events that are happening in our area that you can participate in to help extend your knowledge of suicide prevention and also to take action. The Out of the Darkness Community Walk will be taking place September 15th, starting at 1 p.m. at Wharton Fieldhouse in Moline. And the local NAMI chapter is sponsoring a suicide prevention talk, which will happen September 26th at 6:30 p.m. at Crossroads Church in Morrison. If you or someone you love is struggling in crisis with suicidal thoughts, the Sinisippi Centers has a crisis line that is available 24 hours a day, 1-800-242-7642. And then the National Alliance for Mental Illness has the Sauk Valley chapter, where they offer support group meetings all throughout the area, including Morrison, Sterling, Rochelle, Rock Falls, Dixon, and then meetings that happen virtually online. And finally, there's great resources online. Suicide is Preventable. Again, the website where I resourced a lot of this information is a great place to find conversation starters, warning signs, and lots of the things that we talked about today. Also, the 988 crisis line not only is available for calls and texts, but they have a website too, where again, a lot of these resources are listed. The Suicide Prevention Resource Center has a great evidence-based, science-backed collection, a library of articles and resources that can be helpful. And then again, the National Alliance on Mental Illness has a great website, and that can lead you to local charities and local places that you can find help. Again, thanks so much for joining us today for this presentation. And it's my challenge to all of us that we might not be afraid to talk about these things with those we love, because we don't know who we may save, whose life we may save, because we are able to have some of these difficult conversations. May we all be encouragers and supporters of each other through some of these difficult days. Thanks so much.